So the question is, are there any treatment for failed dental implant cases? So the question first is, do dental implants fail? Well, dental implants have a very good success rate. In our office, we have a success rate of about 95 to 97%. However, do implants fail? They do fail. So implants fail for a number of reasons. Implants fail because the bone does not fuse around the implant, or sometimes we do place the implants good enough, but the patients don't come back for a follow-up, or they don't come back for the follow-up cleanings, or they don't maintain the implants well enough, or they continue to smoke, or they get some medical issues. So for a variety of reasons, implants fail. So what are the treatment options when those implants fail? So when the implants fail, the most conservative treatment that we try to do is we try to salvage the implant. There are a number of treatments available, such as a laser treatment that you can do around the implants, or some kind of a gum surgical procedure, or some type of bone grafting procedure that you can do around the implant to salvage the implant. However, if the implants are not salvageable, sometimes we may end up removing those implants and doing some bone grafting procedure. That way we can go back and replace those implants also. So here's the catch. Just because the implant failed the first time, it doesn't mean that it cannot be replaced. Sometimes, like I said, we are able to salvage them, or even if we have to end up removing them, we can do the bone grafting, and then we can always go back and replace those dental implants. And I hope this answers your question.